Mr. President, over the years, federal funding for medical and scientific research has helped split the atom, defeat polio, create the internet, map the human genome, and so much more. No nation has ever made such a significant investment in science and medicine. None. And no nation's researchers have done more to improve the quality of life, not only here, but around the world. But we are at a pivotal moment in history. All the progress we have made, all the progress we hope to make, is in danger because of Donald Trump and Elon Musk. That's right. These two men promised to bring down the price of eggs and gasoline and make housing more affordable. Well, none of that has happened. Instead, they are carrying out an unprecedented and devastating campaign to cut research on cancer, ALS, Alzheimer's, dementia, and infectious diseases. Instead of making life better for Americans, they want to slash research funding for the National Institutes of Health. If you've never heard of this agency, I hope you'll Google it or take a look in research to figure out who they are and what they do. It is the premier medical research agency in the world. If you or someone you love receives a dreaded diagnosis, you turn to the doctor and ask, is there a cure, a surgery, a medicine? I know I've been there and asked those very questions. The difference between the doctor saying, I'm sorry, there's nothing we can do, and I've got some good news. There's been some research at NIH we should look into. You know all the miracle drugs you see on TV? Can't get away from them, can you? 99% of those drugs approved in the last 10 years were the product, in some way, of NIH research. NIH funding is why people are beating cancer, why babies are being spared from preventable diseases, why HIV is no longer a death sentence, why progress is being made on dementia and other neurological diseases. Since the start of this administration, we have seen the White House unleash a lawless, chaotic attack on everything from funding for farmers to biomedical research. Planes are crashing, and they are cutting aviation safety. Avian flu is on the rise and threatening to make that leap to humans, and we're cutting public health experts. Elon Musk dances across the stage with a chainsaw. People laugh and cheer. First, let me tell you this. There's nothing to cheer about when it comes to medical research. It was this bizarre memo from Office of Management and Budgeting that illegally froze federal grant funding. They even prohibited the recipients of federal grants in medical research from physically meeting in the same place. Oh, you're going to hear arguments, we got to cut back on the waste and fraud and abuse. I'm all for that. But having researchers unable to even sit down and talk about the next breakthrough, how can that possibly be good for our country? These cuts that were announced by this administration were quickly halted by a federal judge in a federal court. There was comment on the floor earlier today that too many people are going to courts. Thank God they went to courts to keep this policy from being implemented by this administration. But it seems even though the court made a ruling, this administration is still holding up funding in violation of the court's order. As a result, NIH has delayed awarding approximately $1 billion in grant funding, delaying research at institutions nationwide. Does a delay hurt? Not unless you're the one sitting in that waiting room at the doctor praying to God there's a breakthrough to save your child. Listen to what's at stake for one of my constituents, Dr. Timothy Coe, professor of kinesiology and nutrition at the University of Illinois in Chicago. For 15 years, Dr. Coe has been researching why people with diabetes develop wounds that do not heal, as well as researching treatments to address these wounds. While having steady federal funding for his research through the years, Dr. Coe was recently informed in the last few weeks that his NIH grant application is on hold because of the Trump-Musk federal funding freeze. His current grant is scheduled to end on Friday of this week, and if his grant is not renewed, he will have to lay off his lab staff and will see major setbacks in the research he's been involved in. Dr. Koh said, and I quote, "It's going to potentially put an end to my research career, and we won't be able to develop these new therapies for diabetic patients." Is diabetes important? If it's someone in your family, it's very important. Make no mistake, under the Constitution, Congress is supposed to have the power of the purse. That's what it reads. But over the decades, bipartisan members of Congress have worked in concert on a bipartisan basis to do something about NIH funding. It was a little over 10 years ago. Francis Collins, I consider to be an American hero and a saint. He headed up the NIH, and I went out to see him and I said, "I can't double your appropriation, I'd do it if I could. What can I do to help you?" He said, "Give the NIH agency 5% real growth every year. And I'll tell you this, two things will happen. We'll light up the scoreboard with breakthroughs and cures for diseases in America. And secondly, my researchers will take heart, because one of the things that destroys their interest in pursuing a career is the uncertainty of federal funding." Well, we went from $30 billion to $48 billion in 10 years because we had a bipartisan team to do it. Patty Murray joined me on the Democratic side. She's always been a champion of medical research. And on the Republican side, Senator Blunt of Missouri was a leader. He was the best. When he chaired a subcommittee of appropriations that funded this agency, he was committed to the 5%. And then Lamar Alexander of Tennessee. Both of those gentlemen have retired. But the four of us put together an effort that raised the NIH funding from $30 billion 10 years ago to $48 billion, a dramatic, dramatic increase. We did it because we all agreed this is not a partisan issue. It should never be. We knew that NIH funding leads to new cures and treatments for patients in need. It supports well-paying jobs nationwide, and it cements our global leadership. Illinois universities and hospitals receive approximately $1.2 billion in NIH funding a year, which supports 14,000 jobs in our state and $3.5 billion in economic activity. But I will tell you, Mr. President, there's virtually every state in the nation that can tell that story in one form or another. Each year, the state of Wyoming receives approximately $12 million in NIH funding. Now, Wyoming is a small state, but they clearly have good research facilities that merit NIH grants. This money supports 265 jobs in Wyoming and $49 million in economic activity. The top NIH-funded institution in Wyoming is the University of Wyoming. With this NIH funding, research at the University of Wyoming have recently conducted the following projects. See if any of those sound close to home or close to your family. Number one, why Alzheimer's disease and dementia can worsen at specific hours of the day. Number two, a project in Wyoming linking between menopause and cardiovascular disease in women and developing a new non-invasive tool to help treat people suffering from epilepsy, schizophrenia, anxiety, and autism. All sound like worthy projects to me. But unfortunately, President Trump and Elon Musk aren't finished there. They tried indiscriminately to slash how NIH pays for indirect costs. Without indirect cost, universities wouldn't be able to afford the technology that allows them to conduct research. Cuts to indirect costs are simply cuts to research, period. The other day we had a debate on the floor on this NIH. One of the Republican senators talked about the outrageous outlying indirect cost in this country. Let's look at them. Let's review them. But to stop all meetings of all medical researchers while we do this, to stop the funding for all of the grantees, to stop all of the medical research because there might be 1 or 2 or 10 schools that ask for too much, or hospitals. Thankfully, the Illinois Attorney General, along with 21 other states' leading attorneys general, sued and secured a temporary reprieve for universities and researchers. Trump and Musk illegally froze federal medical research funding. They tried to illegally cut funding for medical research, and now they're firing the medical researchers themselves. Reports indicate that 1,200 NIH employees have been fired so far, from experienced vaccine researchers to the next generation of scientists, to the acting director of NIH's Alzheimer's and Dementia program. Further, Trump and Musk have reportedly ended a popular trainee program that brought 1,600 young scientists just out of college to the NIH world-renowned campus in Maryland to get them started, working in labs and eventually running labs. They are our future when it comes to medical research. And the Trump and Musk chainsaw chaos of budget cuts has made them victims. How does this make us a greater nation? How does this make us a healthier nation, a better nation? It doesn't. NIH research leads to new cures and treatments that extend, improve, and save lives, which is why I'm introducing this resolution today, to simply say to senators of both sides of the aisle, let's pledge our support to make NIH an exception. Let's not let wanton cuts stop something very valuable. The resolution is straightforward. It says the work of NIH should not be subject to interruption, delay, or funding disruption in violation of the law. In violation of the law. And it reaffirms that the workforce at NIH is essential to sustaining medical progress. Can we really debate that point? Do we think the best medical research agency in the world is being staffed by people who aren't the best? This is not controversial. It shouldn't be. Americans get sick on a bipartisan basis. Shouldn't we support medical research on a bipartisan basis? For as long as I can stand, for as long as I can speak, I will fight to protect NIH and medical research. I hope my Republican colleagues wake up and join me before it's too late. And so, Mr. President, I ask unanimous consent the Senate proceed to the consideration of SRES 93, submitted earlier today. Further, the resolution be agreed to, that the motion to reconsider be considered made and laid upon the table with no intervening action or debate.
Is there an objection?
Mr. President.
The Republican whip.
Mr. President, reserving the right to object, the American people voted to get spending under control. 2 in 3 Americans say that a major problem that we face today in this country is government inefficiency, and I agree. 3 in 4 Americans support eliminating waste, fraud, and abuse in government spending, and there is plenty of it. We need to review how much money we spend. We need to see where it's going. We need to see what is effective and what is not. This is common sense. Families have to do it. States do it. Washington ought to do the same thing. Every family audits their own budgets, their own spending. Every CEO audits their business operations. President Trump and Republicans are doing exactly the same thing, and it's something that federal government has not done for a long time. Let me be clear. I'm a doctor. I support so much of the good work being done by the National Institute of Health and through the universities around the country. It is essential that America continues to lead the world in medical innovation. I'm a strong supporter of continuing smart investment in our National Institute of Health. Americans deserve better care. Americans deserve better prevention and, of course, better transparency. So the total budget for the NIH is almost $48 billion. Hardworking taxpayers deserve smart scrutiny and serious transparency over that kind of money. There is indisputable evidence that there is wasteful overspending of administrative costs associated with medical research, and this is why I'm here saying this must stop. In 2024, Harvard University spent $135 million of government grant money on overhead costs. Clearly, we can do better. They used hardworking taxpayer dollars to pay for heating bills, electricity bills, for maintaining buildings. They used it to cover payroll for people not involved in research. This is money that should have been spent on advancing researching for cures. Harvard's overhead costs related to the National Institute of Health research, 69% of the money goes for overhead. That's taxpayer money, Mr. President. That's one university, 1 year. Clearly, we can do better. So you look at that all across the country. Imagine all the new cures we could find if we just spent the money efficiently. That's what's at stake today, and that's why I'm here on the floor of the Senate. Democrats don't want to have a serious debate about wasteful Washington spending. Instead, they're wasting the Senate's time on predictable distractions like this one, and therefore, Mr. President, I object.
The objection is heard.
Mr. President,
The Democratic whip.
if standing in this Senate and asking Republicans and Democrats to come together to preserve and build medical research is a waste of time What in the world are we doing here? If you were asked to take the federal budget and put your priorities in there, maybe number one would be national defense. Well, I might make that number one as well. But I can tell you number two is medical research. Because what happens when you reach a point where you cut off medical research, these researchers leave the laboratories and say, honey, I don't know if I'll have a job here next year. Let's start looking someplace else. That is not an unusual thing to occur. So the next generation of researchers are being discouraged by the uncertainty of funding. And this notion that we got to get spending under control. How much does it cost to find a cure? What does it cost to have no cure? Let's get down to the bottom line here. We're talking about how long people stay in the hospital or whether they're alive at the end of the experience or not. Some of these medical treatments they have to turn to extremely expensive. Unless you can find a cure, the front end of it, and you don't find it by saying, well, maybe next year we'll spend some money on medical research. That isn't the way it works. You want to have a good doctor you can trust from year to year, not a new one every year with a question mark. And the same thing is true with researchers. If you've got the best researchers, why in the world would you discourage them from their continued work? I listened to this comment about $48 billion. It's a lot of money, for sure, and it's taxpayers' money, and I take it very seriously. But how much do you think it cost if we didn't find these cures, didn't find these drugs? What would it cost in human terms, the experience of families who would give up hope because there's no place to turn? That's a reality. We all have friends, and I had one today, I won't get into detail, who has just learned that he has pancreatic cancer. We don't have a cure yet. If we could find one, do you know how that would change the lives of so many people and their families? Is that worth putting our research into, our tax dollars into, or, as the senator said, who objected to my resolution, just wasting time here on the floor? Well, I'm going to come back and waste time over and over again. I'm not giving up on this. I'm not giving up on families that are waiting for cures and research. I'm not giving up on the researchers who dedicate their lives to finding them. And of course, if we've got some overspending, whether it's at Harvard or Illinois or even the University of Wyoming, let's clean it up. But is it possible to clean that up without jeopardizing the basic mission of the National Institutes of Health? I certainly hope so. To think that we would have to close down the whole agency because a handful of schools are overcharging the federal government, and there's no proof that they are. I think that's part of the reality. Mr. President, this is an issue that's important to every single American, whether they know it or not. We can get spending under control and do it thoughtfully, not at the expense of the best researchers in the world and the expense of cures, which would give families hopes once and for all. I yield the floor. Suggest the absence of quorum.